Hello, my name is Kayla Bradley. I'm a level 2 nursing student, and today I'm going to be showing you how to do a wound care dressing change and assessment. So when I first walk into my patient's room, I'm just going to perform hand hygiene, and then I'm going to verbalize the order change from the physician. So this is Mr. Mancini, and the order is to do a dressing change twice a day with normal saline and apply dry gauze with tape over top. So hello Mr. Mancini, my name is Kayla. He responds to me, and I'm going to double check that this is Mr. Mancini by having him state his name and date of birth, as well as checking his armband as a patient identifier. Then I'm going to go and do a PQRST pain assessment, in which he denies pain, so I can proceed without any intervention, such as pain medications and such. And so I'm going to explain that I'm going to be taking off this dressing, cleaning it with normal saline. It should be pretty painless. Let me know if you're feeling any pain. And then I'll be applying a new dressing as the first round of dressing changes for the day. So I'm going to apply my gloves. So that I can then set up my tray just prior to changing the dressing. So I'm just going to touch the outside edges so that this remains sterile. And there we go. And then I can use my forceps. And I'm going to take this sheet here. And this is going to overlay my patient, just like this. And then I'm going to put these back in as these are sterile, and then I'm going to put some normal saline in my container in preparation for cleaning the wound. Okay, so in order to take off the wound, or the dressing, I'm just going to slowly peel the tape back and such, so that doesn't cause my patient too much pain. So to briefly go over some of the components of a comprehensive wound assessment, so there's wound classification by skin integrity. So this is a open wound as it breaks the skin surface, whereas a closed wound is just like blunt trauma. It's also acute as it's a surgery line, and then a chronic would be like it fails to proceed through an orderly and timely healing process. So there's also this is a class 1 clean wound, as it's an uninfected surgical wound in which no inflammation is encountered. There's also class clean contaminated wounds, or contaminated wounds, or dirty wounds. There's also primary, secondary, and tertiary healing. This is a primary healing as the skin edges are approximated and closed, as well as the secondary is the wound is left open until it becomes filled by a scar tissue. And then tertiary is the wound is left open for several days, and then they try to make it a primary wound by closing it. So there's 3 different complications, well there's more than 3, but 3 different complications of wound healing include infection, dehiscence, which is where the skin, like the wound edges don't heal fully and they break open. And then there's also evisceration, where dehiscence happens fully through the wound layers, and then the visceral organs protrude through. 3 different factors that influence wound healing include age, nutrition, as well as stress levels. These can either promote healing or delay healing depending on the range in the spectrum. There's also 4 different types of wound drainage. This patient here has serous fluid, which is just clear watery fluid, which is normal. There's also purulent, which is like a pus, which would be an indicator of infection. There's also serosanguinous, which is a mixture between serous fluid and then blood. And then there's also sanguinous, which is just red blood cells, and that would be an indicator that we need to just do a double check of this wound to make sure there's not internal bleeding. So I am going to begin by cleansing the wound. So I'm going to use my forceps to grab these tweezers, and then I'm going to take my gauze, soak it in the normal saline, and then I'm I'm going to start by going along like the incision site first, because this is where we want it to be the cleanest, as opposed to bringing bacteria from the outside dermis inwards. And then this is now contaminated, so I'm going to throw it out. I'm going to take another, soak it. And then I'm going to go along the edges. So I'm going to go along this edge first. Throw this out. And I'm going to do one more for the other edge there. Okay, I'm going to put these ones aside because these ones touch the contaminated wound. And then I am going to use these new ones here, as well as my other ones which are still sterile on the tips. And then just go through with my larger gauze pieces to dry it up. I can figure out how to fold these. And then I'm just going to do like a dab, like rolling motion kind of. And I'm going to do one more just to ensure it's dry. Okay, so now that that is done, I can apply a new dressing. So I'm going to grab my pad here, and then I'm just going to open it up into the sterile field, not touching it with my gloves. And then I'm going to use this forcep and my other one. Just grab it like this and apply it to my patient. And now I can apply tape to the edges. This pad is a little bit larger than we expected. Also, if we had a full abdomen here, it would be more realistic. But I'm just going to place the tape around the edges. Okay, and then I am just going to use my pen here and sign it just so that they know who the nurse was that did the dressing last, as well as date it and time. Perfect. Okay. And so now I am going to get rid of all my equipment here properly because it's not needed as a sterile field anymore. I can just throw it here. And then take off my gloves and perform hand hygiene again. Just double check with my patient, let him see how he's feeling. And then I am going to document this within Dovetail at St. Joseph's and make sure that the dressing is changed twice daily. Make sure all documentation on how the wound is healing and everything like that. To address what I would document that this wound is healing well. It's well approximated, there was only serous fluid, as well as the patient doesn't complain of any tenderness or pain, so we would say that this wound is healing well. So thank you for watching, and that's it.